Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Well, good evening, everyone. This is Dr. Joseph Kanu broadcasting live from Rochester Chiropractic Clinic. And we have our beautiful guest, Dr. Jeffrey Haddad. Welcome, Jeff.
Beautiful. I love
Yes.
it. I appreciate that.
Well, Jeff, I've always just really appreciate all the great info you come up with. You know, it's more than just drill and fill a tooth and more than just get rid of your amalgams and so that's kind of.
I appreciate that, Joe. I feel the same way, and it's nice to get the word out to our listeners and sometimes potential patients, and it's been a great thing. You know, I've had some great patients coming in of late actually through our radio show, which is always nice, and that actually what sparked today's topic.
Yep.
Yeah. Which I had a woman who. She's a really sweet older lady who found me through our show and we had a couple issues. One of which she had some dentures, some partial dentures that were really ill-fitting. I mean, they were just very loose and they were bothering her. And in addition to, had a really bad case of dry mouth. And we've touched on this in past shows about how important saliva is. I mean, your saliva is bathing your teeth. It's keeping bacteria from adhering to your teeth and causing the damage that they can. It's flushing out the bacteria. It's keeping things moist, which again keeps any type of damage from occurring to your teeth. It also neutralizes your pH, and we've talked about that in the past about our soda pops and things like that. I mean, we need to neutralize our oral, cavity there, your mouth. It's very, very important because when things start getting too acidic, again, bacteria flourish in there. So saliva,
all the bad stuff, right?
All the bad
we talked about cancer.
Oh,
when you said sleep apnea, lack of oxygen, and acid.
Correct.
Cancer and bacteria, basically. Lack of oxygen, right?
A lot of it, yeah. A lot of it. The anaerobic bacteria. I mean, they love the low or no oxygen, areas. That's where they thrive. And so this woman was great, and I had a lot of good information to give her, and I said, this would be some great information to pass on to the rest of our listeners because a lot of people suffer from dry mouth. And I'm not talking about, maybe you go for a run and have a little dry mouth and you need to just rehydrate. I'm talking about people who every day of their lives have, very dry mouth to a point where the tissues in their mouth is actually burning. This woman actually complained about the fact that she couldn't even brush her teeth or use mouthwash because it burned her mouth. And I'll tell you, it was, luckily I've got some great recommendations for people. This particular woman, I said that makes a lot of sense. A lot of the toothpaste out there, and especially the mouthwashes, which we've talked about in the past, have alcohol in it.
Right.
Alcohol is going to further dry things out and really
dehydrate.
And it's going to give you that burning sensation. So what I think we should start with is talking about what kind of things can cause dry mouth. Then maybe even talk about maybe some symptoms, because I think some people don't even realize that their mouth is dry because they've had it that way for so long. It's the norm for them. They don't know any different. But there's a lot of symptoms that actually you can see intraorally and extraorally on around your lips and in the corner of your mouth that can really lead to realize that you maybe have a dehydration problem or a dry mouth problem.
Wow.
And then we'll give everybody some good tips and recommendations on how they can combat it. Because unfortunately, are some people that you can't cure it. Okay, and let's start off why. Because unfortunately, number one side effect of the majority of medications is what, Dr. Joe?
Well, you taught me, Jeff.
Dry mouth.
Dehydration.
Yep.
Dry mouth.
Exactly.
Dry mouth dehydration.
Dry mouth is also known as xerostomia. And the majority of the most popular drugs, prescription drugs in the world, the major side effect is dry mouth. And unfortunately, if you're talking about your heart medication, your diabetes, your I'm trying to think of some other really important, prescription drugs that a lot of people need to live. There's only certain things you can do, and then you get to a point where you need your prescription drugs.
The high blood pressure.
High blood pressure, perfect example.
That's another one.
Very good. And so these are all drugs that are really a problem as far as dry mouth goes, but you can't stop taking them. So you need to have something to combat that. I'll list some other ones. The depression drugs, anxiety drugs, a lot of the allergy and cold medications, the antihistamines, they all, again, the list goes on and on. I mean, hypertension, like you said, which is high blood pressure. The epileptic drugs, that's a very, very big one. The Parkinson's disease medication. So there's a lot of sedatives, muscle relaxants. I mean, the list goes on and on. I promise.
The painkillers and muscle relaxers really dehydrate us.
Correct. And if we have a person who's listening who doesn't, is unsure of, if their medication causes it, you go right on your little bottle and take a look, because or look it up, Google it. Google is one of the greatest things ever. And I'm going to tell you, one of the number one side effects will probably be xerostomia or dry mouth.
Dry mouth.
Okay. Some other
Cyril,
things.
and that's spelled just like as Xero.
That's correct.
You want to look that up. Stomia, which means mouth.
Right.
So what do we have? Zero saliva in the mouth.
Dryness of the mouth. Yep. And it's really what it's resulting from is diminished or, lack of a better word, arrested salivary glands. Your salivary glands are not producing the saliva that they should be. Okay. And whether it's because of the medications you're taking, whether it be habits, you smokers out there. I mean, that really
dehydration.
Oh, good Lord. That's just changing the entire environment of your tissue, Dehydration, though, just normal dehydration. If you're not hydrating yourself and taking care of yourself, that is an absolute result, is dry mouth, So, we have medications. We've got certain medical conditions. You ever hear of Sjogren's syndrome? That's a big one. That's one of the three main things of Sjogren's is the xerostomia. And again, smoking and lifestyle, chewing tobacco, smoking, these can not only affect saliva production, but really aggravate a dry mouth. Continuously breathing with your mouth open, mouth breathers at night. I mean, that's all drying the environment out. So let's say you have dry mouth, or let's before we get to that, let's say you're not sure, and you maybe you could, maybe you're taking the medication, but you don't really notice it because you don't know the difference. Here are some symptoms of dry mouth. Okay, obviously a sticky and dry feeling in the mouth, frequent thirst, sores in the mouth. Okay,
sores, yeah,
absolutely.
Okay.
Cracked lips is a good one, okay? That's not always a result of just the weather, okay? Cracked lips can also be, again, a dehydration problem or a bad saliva production. Another good one that I like to tell people, are you familiar with angular cheilitis?
No.
No? Come on, Joe. I want you to spell that for me. Angular cheilitis.
Sjogren's, yes. Xerostomia, yes. No, angular
I'm sorry.
cheilitis.
I got to stump him, folks.
I've heard of colitis, but not.
Nope. This is on the other end. Angular cheilitis is actually, the crust that can be right at the corners of your mouth.
Corners.
Yep. The angular, that's really the angle of your mouth, cheilitis. So those are.
How do you spell cheilitis?
You're gonna get it. Try to give me CHEILITIS. I was great in spelling bees back in the day. But yeah, this is another thing that crust around there. Now, obviously, that can be result of not only dry mouth, but it can also be lack of support of the back teeth. And this woman today that we're talking about,
lack of support of the back teeth.
If you start getting that nose to the chin touching,
right,
of losing you're losing that support, that's what happens.
The teeth height.
That's correct.
When the teeth start wearing down.
You got it. Or loss of teeth. In this particular woman's case, she actually lost several teeth, and she needed to be really built back up with a set of dentures, and unfortunately her dentures just they weren't
you were
fitting
saying
well
like
anymore.
Sleep apnea will cause it, right?
Oh yeah,
and mouthwashes or
no question about it. I mean, there's a lot of things out there, and this woman literally wasn't brushing her teeth.
I think it's so funny that mouthwashes. I mean, you gave some great natural remedies for mouthwashes.
Well, there's some good essential oils out there that help. In this woman's case today, I'll be honest, I went the commercial route with her, and by that I mean they're great products, but I actually quoted you because these were very, very natural seeking patients, very holistic, and I was explaining to them about your take on topical things and how as long as we're not ingesting them, topical is good, especially fluoride. I mean, as long as you're not ingesting a ton of fluoride, topical fluoride is the best thing you can do for your teeth, okay? And we know that. The product that I recommended to her that I found is one of the better ones out there, and it's a great company. They have a lot of different products. It's called Biotene, Biotene, and you can look that up on the internet. And we have these little samples that we give to our patients. One is a rinse, okay, no alcohol in it at all, but again, it keeps the mouth moist. Tries to stimulate some salivary production, and again, we'll use the word artificial. It is, but it's keeping the environment safe, because if it's not, you're going to start having bigger problems with decay problems and issues with your actual teeth. Okay. The other nice thing about this is that they have toothpaste that's not going to aggravate or burn your tissues. Again, the way that it's very, very sensitive to dry mouth, and they also have this gel within it. It's like a moistener gel that you can put on the inside of around your gums and things like that. And again, I've had very good responses from my patients. Very, very happy about it. In fact, Colgate actually just came out with another one too. Colgate had one, and I don't have the name of that one offhand, but it's new. And again, there's some things out there that work for everybody. But Biotene is probably one of the bigger companies out there, and I've really seen good results with them.
Do you know what's in it, Jeff?
Well, I don't have it on me here, and I can tell you, and obviously the internet can do a better job than I can. But again, it's you get back to what things stimulate salivary flow, and you talk about we've talked about the past about your lemons and things like that. I mean, honestly, things like that are very good. You want some tricks I gave this woman today, and I'm going to tell our listeners tonight are if you want to stimulate salivary flow. Mints are very good, but please don't you dare go out there and get some Altoids, even though they will stimulate a ton of salivary flow. Altoids, I've had people who have Altoids just sitting in their mouths all day long, and I mean the damage that sugar can do in a dry mouth, or any mouth for that matter, just sitting right against a tooth is a problem, okay? One that I recommend is called a Theramint. It's Theramint, and it has xylitol in it. You familiar with xylitol?
Yes.
Xylitol is great. It's a natural ingredient that actually promotes.
Like XYLI.
Is this a spelling bee today? This is
How
unbelievable.
do you spell xylitol?
Wow. I feel like I need some cue cards
here. Is that
here.
a Latin or is that Greek? It's Greek.
Is it Greek? All right. I love the Greeks. But yeah, xylitol is it's actually proven to actually remineralize tooth structure. If you have the
xylitol gum.
Xylitol gum, exactly. So Theramints I'm a big fan of because it does two things. It stimulates the salivary glands and can actually not only protect but make them stronger, re-strengthen some of your teeth. Because what happens is this. If you have decay starting on a tooth, if it stays with an enamel, we can watch it. Okay, you may have had your dentist look at a tooth and say, oh, you know what, it's not big enough, we can watch it. Well, that's good. But once it gets to a certain point in your tooth, you cannot watch it anymore. Or you're just going to watch it get bigger and bigger and bigger, faster and faster and faster, and you're going to be looking at bad things like root canals and crowns. So if it's still within the enamel, and it's just started, it's what we call demineralization.
Right.
That xylitol will actually remineralize it and get things back on track. So it's a very good product. Highly recommend it.
Yeah, well, that's great for the mouth.
Absolutely. No, there's no question about it. And,
I know the only downside to xylitol would be people who have ulcerative colitis. It can aggravate that. But I mean, there's always.
And I did not know that. That's great to know.
If you don't have a problem with ulcerative colitis, xylitol is definitely the choice of gum or mouthwashes. You
are a wealth of information. I love it. No,
so,
that's very. I did
Jeff,
not know that.
One thing that does increase saliva production, of course, is keeping your enzymes. We've talked about the body is electric, the brain, the spinal cord. We run on electricity, and we need beyond vitamins and minerals is enzymes, live food, right?
Right.
So the dark leafy greens, apple cider vinegar, like you said, the mint.
Right.
I mean, you don't want to suck on Altoids, but it is good. Drinking mint and dandelion tea, peppermint dandelion tea, actually, and the other thing is increasing cabbage in your system.
Real okay, good.
Cabbage is something that helps to increase salivary flow.
Excellent.
Besides the mint, the dandelion tea, and then trying to eat as much live foods as you can.
Right.
Increasing your enzymatic activity.
That's great. Right? No, see that's
live.
That is why we make such a good team.
Yeah.
That's very good advice.
Even the healthy chocolate loaded with your enzymes and antioxidants. That's what helps produce the saliva.
Well, and that healthy chocolate, the liquid. I mean, just to rinse out with that. I mean, first of all, it tastes great. I'm such a big fan of healthy chocolate. I love it. But yeah, I mean, I think that's again, anything that you can do in your mouth that's going to neutralize things, keep things at out of that acidic arena is going to be good. But just keeping things moist is very, very important. I mean, back to people. This woman today who have dentures. People who have dentures and have dry mouth are at an increased risk of fungus, okay? And you can actually get fungus growth in the mouth called Candida albicans. Okay?
Candida, right.
Okay, and you're going to make me spell that too? I can do it if you want. But in addition to, on the actual denture, I was taught in dental school, it's kind of strange some of the little things you pick up, but if a patient comes in and it's a denture wear and they have this fungus infection, you've got to treat not only the patient, but you got to treat the denture too. Okay, because that fungus gets embedded into the appliance, and it's just going back and forth.
And then it's getting into your system, just like the candida,
exactly,
like you talked about.
Exactly,
the whole body.
Yeah, and I mean, it really, when it
comes systemic, you would call that.
Right, correct. And so, this, I kind of, it's actually great. I mean, just talking about this woman today, there's so many things that were pertinent to not only our conversation tonight, but others in the past. She had these ill-fitting dentures, and she wasn't enjoying eating. And I told her, I said, well, we can make you some better-fitting dentures here. We could. I mean, there's a lot of ways to make them a lot more secure. But I'll tell you.
You talked about the implants.
Well, and
right?
that's really where I would, if I had my druthers, I would love to transition any and all partial or denture wears into dental implants.
How could you not want implants?
Well,
I mean, just for your overall health, like you said, the chewing ability plus the bone loss.
The bone loss is huge. If you remember
some great shows
when we brought in. If for those of you who missed one of our shows, I literally brought in 4 examples of jawbones, and it was the sequence of a healthy jawbone with teeth, and then once the teeth were gone, after several years, how literally your jawbone deteriorates. You literally lose bone. It just
diminishes to.
And unfortunately, if you don't have something stimulating that bone, you have some issues there. And so dental implants do that.
It's almost like disuse atrophy, right? You don't use it your body just wastes away.
You got it. And so I was worried about this woman today because she had the dry mouth thing happening. She had ill-fitting dentures.
Do you find that more with denture wearers, Jeff?
Well, it can be. And you know why, though? A lot of times it goes hand in hand with age and number of medications. Sadly, as we get older, I think the majority of people are on more and more medications. And I just went through that lengthy list, it is a problem. And it's unfortunately a problem that I don't think it's going away anytime soon. So we need to combat it. We need to let these people take their medications unless they can get off them. But if they're taking them, we need to deal with it, And again, denture wearers usually are older patients who have been on medications for a while. And so it's, there's so many factors, but yeah, that patient pool is really kind of goes all hand in hand. And so when we have a denture wearer who has dry mouth, the other thing that happens, and this, again, I explained, briefly to this woman, it can actually cause the dentures to fit poorly. A lot of dentures are based on suction. If there's no moisture, we got a problem.
Right. It's kind of like sticking your foot in muck. And stepping into muck, and then you have pull your foot right out of your boot because that's suction or quicksand.
Yeah, you want that's what you want.
You need some suction to hold. Yeah,
that's correct. You walk in sand. That's not happening.
You know what? Any of you who wear dentures, please call Dr. Jeff Haddad, 248-656-2020, and get implants.
Yeah.
It's basically 2 posts, right?
It depends on the situation.
I know it.
Yeah, it really does. But I mean, really, when it comes down to it, if you have a denture, having something that stabilizes it not only is better for your overall health, which we've talked about before. John Hopkins says that the number 4 thing out of the top 10 things you can do to be healthier is to get dental implants if you have dentures. It will help.
That's amazing.
Isn't it? I mean, if a denture wearer can only masticate, can only eat
so
at 10%.
This isn't cosmetics. This is your
Lord, no.
life depending
Quality
on
of life.
Yeah.
Quality of life. And so, I mean, having the chance to chew again, and again, to save your bone, I agree. And, there are some people that aren't candidates, and there's a lot of people who are. And there's a lot of people who are told they weren't candidates, but because of our 3D technology that we have, are actually able to have dental implants now. So if you have ever thought about it, or maybe even been told in the past that you weren't a candidate,
great.
Take a look at my website, RochesterAdvancedDentistry.com. There's a myriad of information on there about dental implants, about our cone beam 3D technology, and how we literally can do a surgery digitally, virtually, before I even touch a patient. We'll know if you're able to have dental implants, where they need to go, how many you need. We'll know all that. And if you're looking for something like that, or even curious about what the possibilities are, this is what I do consultations for. You can call our office at 248-656-2020. It is. I agree with you. It's a life changer, Joe.
Yes.
It really is.
Yeah.
And for those of you who are experiencing the denture / dry mouth situation that we're talking about tonight, this really is a perfect solution for you. It really can be the right thing for you, and can change your life overall. So, no, I'm glad you're saying that, Joe, because I couldn't say it enough. I see patients' lives change right away when we transition them from the, removable, sloppy dentures that are not fitting well to something that's secure and anchored in their mouth.
Yeah. Beautiful.
Yeah,
so Jeff, this dry mouth, you were talking about, of course, alcohol, a lot of mouthwashes, medications causing the dry mouth.
Right.
We've offered some solutions.
Correct.
Right.
Smokers, again, I mean, that's going against your salivary glands as well. Smoking and chewing tobacco. I mean, obviously, besides the cancerous problem, but it's
usually anything that's opposite enzymes, live food, the chocolate, dandelion, and peppermint tea, increasing our dark leafy greens, eating live food. What else the apnea, right?
Right.
How does that dry your mouth? Because you were talking about sleep apnea.
Well, when we breathe at night, okay, if you're a mouth breather,
being a mouth breather,
it's a problem, and that's why at night, we've talked about on other shows where, if you're not brushing your teeth, flossing before you go to bed, getting things clean before you go to bed, you've got 6 to 9 hours, however long you sleep, of possibly the perfect environment for decay and bacteria to flourish. You've set them up. You've set yourself up for failure and set them up for success, because if you're breathing through your mouth, your saliva is not helping you. Everything's dried out. Bacteria easily adhere to the teeth and cause a damage. Then it's got the food from the night before that you didn't brush out of your teeth, or the floss, or the lack of flossing and sitting there, so that it's got food to feed on and the dry environment. It's a recipe for disaster.
Yeah.
How's that for blunt and getting out there and scaring people? Okay, so that is the worst thing you do for yourself. Yes. Sleep apnea is just more of the fact that most sleep apnea patients do, they snore.
Sure.
They're breathing through their mouth. You can breathe through your nose, of course, too, but at night in general, it's a matter of a dry situation that you want to avoid.
Sure. I guess the last thing would be, staying hydrated, right?
No question.
So, and I find sometimes when I'm dehydrated that if I just drink water, it runs right through me. Right. Where if I'm eating watermelon, grapes, things, or if I have water, throwing like the lemon, or the raspberry leaf tea, right, which is very alkaline, mm-hmm, but it flavors it and it seems to stabilize the water where you absorb it better. Right. Or you eat watermelon, it stabilizes things as well. So anyway.
No, I agree. And I think that really anything that you can put in your water to make it, you drink it, you do it. Okay, yeah. I know I get to trick myself. Water gets a little boring here. As long as it's not sugar. Right. Cucumbers, strawberries, raspberry, anything that just flavors it, natural. I think it's all good stuff.
Yeah. Great, Jeff. Well, thanks for the show. Another great show.
I think we educated some more tonight.
We nailed this one pretty good.
I think we hit it. We hit it home.
So, anyways, if any of you would like to get a hold of Jeff, you can call Rochester Advanced Dentistry at 248-656-2020. You can go to our website, simpletruthsforhealthyliving.com, and listen to all his shows, his Wednesday shows. Your website, Jeff, is
RochesterAdvancedDentistry.com.
Yes. Well, thank you for listening, and remember, in all that you do, eat or drink, do all things to the glory of God.
It all starts with a smile. At Rochester Advanced Dentistry, a new smile is waiting for you. Experience the differences when you walk in the door. Extraordinary comfort, a deep level of trust, an appreciation for beauty. With over 20 years of experience in the most advanced techniques in cosmetic dentistry, TMJ treatment, dental implants, and sleep apnea, Dr. Doolin and Dr. Haddad can give you the life you've always dreamed of. And it all starts with a beautiful smile. For more information, visit RochesterAdvancedDentistry.com or call Rochester Advanced Dentistry at 248-656-2020. That's 248-656-2020. You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.